We fought for everything we have here, and we're still fighting to keep it. We're Miramichi, and we'll fight hard and strong and stick together. Dr. Losier, would you like to come up and
Thanks, Kelly, and thank you for inviting me here to speak. It's quite an impressive turnout of people. I really was pleased to be asked to talk tonight about the issue of alternative level of care. And I'd like everybody that's not involved in the hospital to understand what that means. So that you walk out of here tonight with some understanding of what's going to happen to the hospital. We have now roughly in the vicinity of 160 beds at our hospital. And what the government plans to do is to decrease that to roughly 40 less beds, if you want to make round numbers. And the services to those beds will change. They'll be in the hospital. They're right when the Minister of Health says that the beds are still going to be there and they're not disappearing. But they're going to be in the hospital. But these beds will be treated differently. They'll be treated as nursing home beds in the hospital. So it means that all those clients and patients that exist in those beds will get nursing home status. And the problem is that the quality of care that you get in a nursing home is much better than you get in an alternative level of care. So basically they're getting sub-care for what they're classified as. They're classified as nursing home alternative level of care, but they're not really getting nursing home care because they're not receiving the extracurricular type of activities that they get from activity management and from the type of services that you see in a nursing home. So when they change this to ALC, there'll be gainers and there will be losers in our hospital. There'll be gainers because they're going to hire what they call PW1s or PW2s and nursing assistants. But they're going to have to lay off to bring it down to a lower level some of the RNs that work in the hospital or dispatch them to other areas in the health facility. These are people that have worked in these floors for the last 15 or so years. So there's going to be some displacement. So the problem is with our hospital is that we have always wanted the ALCs that we knew we were going to get at some point not in our hospital. We wanted them as nursing home beds, and we wanted a nursing home. So we wanted those 40 people. We wanted those 40 people put in nursing homes. So the last government had approved that the Mount St. Joseph would be rebuilt, but no extra beds, okay? So no extra beds. They would get some additional beds in the Niguac area. So what's happened now since the last election is that other areas, there's been some dirty pool going on here, other communities in Horizon, in their network, they have the Moncton, Fredericton, St. John, and we are the fourth region that exists in Horizon. So other regions have gotten new nursing home beds. For example, Moncton, Fredericton, and St. John have 3 facilities that all hold 78 new patients in them, new nursing home patients. And these facilities were all in addition to what other healthcare buildings that they had. So they've gained. We haven't gotten one bed, not one bed in our area. So they're going to decrease the amount of active care beds in our hospital by 25%. So how is that important? Because funding to your regional hospital has to do with active care beds. And it also has to do with the size of your population and the service that you offer, the level of care you offer. So if we get the number of active care beds down by 25% and we lose the trauma center and we lose our boundaries, which they were trying to cut into by this supposed assessment when they were going around to the communities, then you are going to lose dollars coming to your regional hospital, and we definitely do not want that. The government announced, well, they have an initiative where they're going to spend money at the regional hospital here, and they're going to give us an MRI. A lot of promises there. Seemed like everybody was tripping over everybody last time the election came about to give us an MRI, but we've yet to see it. They've also announced a $3.5 million MRI, a $1 million announcement for additional radiology equipment, and a $320-some thousand equipment for other things. So the problem with New Brunswick is New Brunswick's population is aging, and it's aging at a very rapid rate, and there's a lot of seniors developing in New Brunswick. It's estimated that by 2015 in Canada, every 2 minutes, one person in this country is going to turn 65. One person. By 2030, one person every minute is going to turn 65 in Canada. So you have an enormous burden that the population is being looked after, the elderly population, because we're all living older, and there's going to be many people who are 80, 90, and 100 years older being looked after by a fewer amount of people. So we definitely are going to need nursing homes in the future. The problem is that they've looked at every other area but us. I've always looked at the problem with New Brunswick as to some extent, and this is not being an insult to anybody, but as the bilingual issue, and we all know that. It seems that the Miramichi is on the fringe of the Francophone north with Bathurst and Carrickhead and Shippican, and the government did a study in, I think, 2002, I think it was called the ABI study, and what they wanted to do was make Bathurst the center of the north. But the problem is that we're right on the fringe of that, so we're in horizon. So to keep that mandate, they've continuously tried to demoralize or diminish the Miramichi by cutting the boundaries, by sending the trauma center to Bathurst, by doing all these things. But the problem is that we're losing because of that. So my solution or suggestion, and I'm not here to talk about the enormous problem with the jobs, because I'm not an expert on that, but there's going to be some dislocation for sure, even though Mr. Peters says there's not. But I think that our community leaders, our mayor, our MLAs, have to push harder for a nursing home. We have... We have two. You okay? Yeah. We have two nursing homes in our area. We have the Mount St. Joseph and the Miramichi Senior Citizens Home. Those two nursing homes have almost 200 patients in them. The administrations hardly ever talk to each other. They hardly ever communicate with each other. It's very important that we use the fact that we have those two nursing homes and force the administrations of those nursing homes together, force your MLAs, your mayor, to encourage the government to build a new state-of-the-art nursing home and expand the number that it will hold. We would get employment out of it. We would get a number of beds. That would allow the hospital to have beds so that the people that are in the emergency room every day, backed up, 3 and 4 people in one room in a cubicle, which is unfit, unsafe, not very sanitary, and also really disrespectful to these patients constantly with 10 and 12. With 10 and 12 patients every day in a hospital in little cubicles where you have to ask questions that are personal to patients, that there's someone beside them that's hearing every little aspect of the conversation. It's so inappropriate, unprofessional. They don't deserve that. So I'm asking you, I have a petition that has 9,000 names signed to it asking for more nursing home beds in our area. I'm asking, Badger, do whatever you can. Get your MLAs, get the heads of Mount St. Joseph's, the head of the Miramichi Senior Citizens Home, the council, demand that we get one huge new nursing homes with 50 extra beds in our area. Thank you.